Hi, welcome back. It's Gerald Major coming from hashtag See Arthritis. We're at the Canadian Rheumatology Association Allied Health Care Professionals annual scientific meeting, and I'm here today with Nicole Johnson. So what we're going to do is give us a little intro on who you are, where you're working, and what your connection is to rheumatology.
So my name's Dr. Nicole Johnson, as you mentioned. I'm a pediatric rheumatologist and I work out of Calgary at the Alberta Children's Hospital. And I see patients typically under 18, but I also do the transition of kids who are transitioned to university to work life in the young adult years.
That's a very important topic lately, is the transition. And I've actually spoken to people that are doing both pediatric and adult. So they'd be great transitionists. So what typically have been the issues on transition in the past?
I think just if you think about building bridges, I think building the bridge between a pediatric versus an adult physical space, but emotional space in terms of finding the right fit for our young patients to move on to an adult rheumatologist that they feel comfortable with, knowing that many of them have had years with their pediatric rheumatologist, so it's a big shift for them physically and emotionally.
People perceive there to be a communication issue with pediatrics or in pediatrics now. I would assume that you've got some type of solution for that?
We do our best. So from a communication point of view, do you mean between the patient to their new doctor or the old doctor to new?
I think it's from the patient, from you to your patients. That communication, has it been difficult to extract from children how they're feeling or if they're in pain or?
There are multiple ways to look at it. There are times where through our pediatric training, we are taught those communication skills to get history out of anyone who can relate. So we do spend time, even you could be 2, 3, 4, we try to get them to express their feelings and tell us what's going on, and then allow the parents also to contribute. Lately, we worked on a project that my colleague, Dr. Päivi Metinen, produced here at the meeting and presented orally, was children telling their stories.
Right.
And what we learned from that project is they have a wealth to teach us, no matter the age, no matter how long they've had their disease. And through the videos, they're shared their journey, which I think is very powerful. So we were hoping that they had a good experience through it, but we also realized that we learned something unexpected about their own message about having their sort of invisible disease to some.
And what was that message?
One of the things is they wanted to be seen as very capable. So they said people focused on the things that they couldn't do, and what they wanted us to do was focus on the things that they can do.
And isn't that funny that later in life with adults we try to teach that very thing? So now we're catching it
Earlier.
From our kids.
Absolutely.
Earlier. That's beautiful. So what's your most exciting thing to be here to hear, or what has surprised you or enlightened you here at the CRA to this point?
I think I see it from multiple perspectives. I see it from a pediatric perspective to see the growth of pediatric rheumatology. I see the strength that we have within the CRA, the Canadian Rheumatology Association. I see more patient perspective, allied health perspective presented, which is empowering because we work in a multidisciplinary team. New learning about what we can do to provide care for our patients. So whenever there's new medications, new strategies, thinking of patient-related outcomes being part of what we do, just lots of new learning.
So we're not just saying shared care and multidisciplinary, we're actually doing it.
Yes, and having even sessions here talking about how do you communicate with your patients more effectively, having sessions of how do you train our upcoming physicians more effectively. All of that's exciting because my other hat is education.
I learn from my daughter all the time in the way that sometimes she just simply puts things and it just makes complete sense. So I can imagine that's just when you overlay that with disease. I would imagine you're getting lots
We
of...
get that all day long
lots of
in
good
pediatrics, for sure, because they will tell it straight.
So from a allied health professional, I'm not sure if you saw the pre-course or not, but
No, I wasn't part of it.
so in what way in your practice or do you use or take support from allied health?
Our team's quite big, so integrated within the clinic, we have our nurses, physiotherapy, occupational therapy, pharmacy, social work, and we have access to dietitians, for example, so we use them on a daily basis.
Talk a little bit about the social work and adding that in, because I think that's fairly new to arthritis, no?
Pediatrics,
Okay.
no.
Not for pediatrics, that's
No.
beautiful. So we're not repeating mistakes.
No.
Also, isn't that awesome?
Not for pediatrics. Some communities are quite stretched for resources, so it does vary geographically, certainly. But the understanding that there is a need for the assistance with social work, we do reach out. We do advocate for those communities that don't have that access, but it's an understood part of the holistic care.
So, seeing as you have other issues solved, what is the option for kids that are in remote areas?
Sadly, with Canada's geography, a lot of children do travel far for their care. So whether that is flying, driving, train, we still have a lot of patients that travel hours on end to come. We do have some satellite communities where pediatric rheumatologists are solo in their practices, trying to reach out to those communities. Pediatric rheumatology is not exclusively to an academic center, it's almost, unlike adult rheumatology where there are a lot of people in the community.
Right.
But we're slowly providing support to community pediatric rheumatologists so that we can serve these small communities. Some telehealth in some scenarios.
Does telehealth work?
Not as much for us in terms of peds, but certainly we reach out to each other to support. I do some outreach to the Caribbean because that's where I'm from too. So
Excellent.
I have colleagues that email me once in a blue moon and says, "Can we talk?"
Right, and you'll travel.
Yeah.
Why not?
Yeah. And I do talk. Yeah.
Do we have any questions from the audience?
How can parents or people at the school help those living with juvenile arthritis?
We do a lot in terms of, sometimes it's an interface with the parent and child with their teachers, so just being able to be open about the fact that they do have a chronic illness. We do provide information back to the school, so for example, if we think the children shouldn't carry a heavy backpack, we'll communicate that. They should have extra textbooks. They should be allowed ability to use different devices to do their notes, for example, typing, giving computers voice applications so they can talk their homework, for example, record their homework. Just another project that's happening with one of our graduate students in health sciences in Calgary. She's done a beautiful thing on barriers to school, children's barriers at school. And again, we're learning that even though we put those things in place, the kids are quite shy to share their story. So we're trying to take that pilot project a bit further, just to see how else can we help them in school.
Where can people find more information about the study?
Not yet published, working on it, but she's presented previously at the Canadian Rheumatology meeting as well. Mm-hmm.
Well, thank you so much.
You're
It was a
very
pleasure
welcome.
meeting you this morning, and I love the work that you're doing.
Well, I love the work you're doing.
I think that we're in great hands for the
Thank
future
you.
of rheumatology. Thank you very
Thank
much.
you very much.